Hey everybody, and welcome back to the channel. Today we're going to be talking about diabetes and dementia. There are studies that show if you have diabetes, you are at a 2 to 3 times increased risk of developing any form of dementia. And there are many forms of dementia, but a lot of them are caused by the same thing, which we're going to be talking about today. And so I want to cover this a little bit more in depth so that you can understand how diabetes and dementia are linked, the processes that go behind this, because if I can help you understand how the development of this occurs, then all we really have to do is reverse engineer it and we can address it from the very start or for the root cause of what could be causing it. And so I've had several people reach out to me lately because of my extended education in neurology to help them understand what is going on with this whole diabetes causing the dementia. So let's dive into it. The first thing that happens that we need to understand when it comes to diabetes, why it causes so many issues, is this process called glycation. And this is when sugars bind to proteins, and proteins are essential for almost every function in your body. If you don't have proper amounts of protein, you can't build muscle, you can't build hair tissue, you can't reconstruct ligaments, you can't build tendons, you can't build neurotransmitters, you can't make certain reparative processes, you can't make energy with the protein. And when those sugars bind to those proteins, it inhibits all of those processes from being carried out. And this is also very important when it comes to the networks in the brain, is that these sugars will bind to proteins in the brain and prevent them from carrying out processes that may necessarily repair the brain and lead to the development of memories. And so glycation is the root cause and is what is causing the damage to, when we look at diabetes, to the pancreas, to the eyes, when we look at like a diabetic retinopathy, when we look at peripheral neuropathy, it's the binding of these proteins that are damaging the nerves and the blood vessels. So this whole process is mediated by overconsumption of simple sugars. So that's as simple as I can make it. If you have questions, just comment below if you need a further understanding, but I really want to keep it as simple as possible. So glycation is sugars that bind to proteins that cause the damage, okay? So with glycation, and when we're talking about it developing diabetes and developing in the brain and causing dementia, increased blood sugars will cause this to happen. And what happens is that I'm going to talk about leaky gut and leaky brain a little bit later, but the higher our blood sugars are, the more glycation we're going to get. So if we're consuming those simple sugars and spiking our blood sugars, then we're going to get more damage, and this can expedite that process, okay? This can also lead to insulin resistance. If you haven't heard of insulin resistance, it's where you aren't able to uptake those blood sugars into the muscle tissue or to the fat tissue, so your blood sugars stay higher. And why this is an issue is because it's going to cause more arterial damage, okay? So that means it's going to cause more damage to the blood vessels. There are many links now between heart disease and higher blood sugars. The easiest way for me to describe this, I have more videos in depth on this if you want to go check them out, but sugar will cause damage to the blood vessels. And what happens is cholesterol comes to patch that damage in the arterial wall. And what happens is you get less and less blood flow because you need more and more cholesterol, especially if you keep consuming those sugars and don't make dietary changes to fix and make sure that that wall doesn't burst. And as a byproduct, you get less flow, and that's what causes a lot of these issues. But when it comes to insulin resistance, the reason you need to address it is because you need to get those blood sugars out of the arterial system and into the muscle tissue for utilization. Now, this also leads to dehydration, because the higher that your blood sugars are, it works through what's called osmosis. So you're going to actually pull water from your tissues, so your brain or your heart or your muscles, and you're going to pull it into your bloodstream, and this causes what? This causes increased blood pressure. So a lot of these people who are having increases in blood pressure, plus they're a diabetic, a lot of the times it's just due to simple biochemistry that increased sugars lead to an increased BP. So you have to address the root cause of the problem, okay? So now, why does all of this matter? Well, more research is coming out about the link between diabetes and dementia, and now they're calling this type 3 diabetes, which is known as Alzheimer's. And this is escalating, so there are more and more people developing Alzheimer's than there have been in years, and it's because of our overconsumption of sugar. And to address this, we know that this glycation, this binding of proteins, damages the brain, especially the hippocampus, which is where our memories are stored, especially our long-term memory. And the more damage that occurs in this hippocampal area, the less we can remember. When we talk about like short-term, like forgetting, words or language centers, or we're talking about like we forgot where our keys are, a lot of this is more towards that parietal frontal area. Sorry about the construction work, but it's occurring more so in that area. So you can really bias which areas it's affecting more than others, depending on if we're having more short-term memory deficits or we're having more long-term memory deficits. And so it doesn't really matter because the process is the same in either one. Now, there are certain therapies that you can do to address different areas, but that is a more in-depth conversation. So when we get the affecting of these memory areas, what's happening is there's too much sugar that's binding to the proteins that help create those neural networks that create memory so that you can recall. And when that happens, what we all see is that cognitive ability slowly declines. And as this glycation, as you glycate more and more of the brain, you start seeing cognitive deficits, you'll start seeing emotional issues. When you see the optic, like an optic neuritis, your visual acuity will go down. So we know that that is very common in diabetics because it's binding to that optic nerve and causing it not to be able to perform its functions. But it also affects the PNS, or the peripheral nervous system, as well. And that's a lot what we treat here in the office. Now, we find that a lot of people are having damage done to the blood vasculature, the microvasculature in their hands and their feet, because they're smaller and they're more susceptible to this whole glycation process. So not only does it affect the nerves and the nervous system, but it also affects the vascularity and the microvasculature, right? It just looks different in different areas. But like we said, the root cause is always the same. And then the last thing that I wanted to cover so that you have a full understanding is that if you have any type of gut issues, we're understanding that the link between gut health and brain health is intricately intertwined. And so leaky gut, the barriers that make up your gut so you don't have proteins, viruses, and bacteria leaking into your bloodstream are almost the same in the brain. And if we have breakdown of that gut barrier, we know we're going to have breakdown of that brain barrier as well. So digestive issues, along with brain fog, chronic fatigue, feeling like you need to take a nap, cognitive issues, memory issues, a lot of those correlate. And if one thing that I have found clinically is that if you don't address the gut, then a lot of times you can't address the brain appropriately. And there are supplements and dietary habits that you can use to address this. But overall, you just need to cut out simple sugars, eat less processed food, just start there. Now, if you want to learn more about certain supplements or dietary habits, go check out some of my past videos where we break those down and dive in further. So, like I said, a lot of the times we use like aloe vera and glutamine in order to heal up these gut barriers, to seal them up. but it can be very lengthy and it can take a certain amount of time. So you need to make sure that you have appropriate expectations when it comes to addressing this appropriately. So this is a breakdown of why diabetes can 2 to 3x your risk for the development of dementia, how the whole process works, what are some risk factors, dehydration, increased blood pressure, maybe you have heart disease or something else going on. But with that, I hope you better understand that process and why it's occurring. And like this video if you found it helpful. Please help me if you can share this video with your friends or loved ones, somebody who needs to understand why this is happening that maybe they haven't had it explained to. And yeah, please comment below if you have any questions about this whole process, because I want to help you understand how to live healthy, to overcome your health issues so that you can have the highest quality of life as possible. So thank you for your time. I apologize about the sounds, and I'll see you all next time.